In the last COVID-19 update from the Ghana Health Service, 5 more deaths have been recorded with 166 new cases. It brings the case count to 43,260 confirmed since March, with 41,267 recoveries and discharges and 261 deaths. The latest deaths include a 36-year-old male from Greater Accra with an unknown comorbidity, while the new cases being tested on 1,499 samples had a positivity rate of 11%. The Ghana Public Health Association has meanwhile listed a raft of recommendations on how it believes the country should tackle the pandemic going forward. Among the recommendations is a barring of the citizens of some countries from entering Ghana when the airport is finally opened to international travel. Now, joining me via Zoom is the General Secretary of the Association, Dr. Gilbert Buckle. Doc, thank you so much for joining us. Now, the Ghana Health Service has come under fire for not conducting enough COVID-19 tests and thereby downplaying the COVID-19 situation. This they have denied today, but where do you stand on that?
Again, thank you very much for having us on the show. I also just listened to the Director General with his statements, and from a public health perspective, the description he gave of what a contact is and what a contact tracing is acceptable and is the proper thing to do. We are not privy to any other information apart from what has been put out in the public domain. Our colleagues in the Public Health Association who are on the ground have not indicated that there's a conscious effort not to test individuals. So really, the description the Director General gave is accurate from a practice perspective.
Now you are recommending that passengers from Europe, USA, and Latin America should not be allowed into the country when the borders are open to international travel. Why exactly are you saying that?
This is not new to Ghana, and it shouldn't be new to the countries involved. These are high-risk countries where the virus is spreading, where infection rates are soaring. It would be negligent on our part not to recognize the potential risk of having nationals or persons in these environments coming into Ghana. And I want to believe European countries and others have done similar in the interest of their people, and Ghana should not be seen to be any different in that situation. There's nothing personal about this recommendation, but it's only practical public health practice to limit high-risk individuals to get into environments which have low risk like Ghana itself.
I'm grateful for your time. Dr. Gilbert Buckle is the General Secretary of the Ghana Public Health Association. He's been recommending he's been giving recommendations for opening of international travel. Mr. Buckle, please stay on for me because we have Albert Story and Rafiq Salam, who are our correspondents in the Upper East and Upper West regions. Let me start with Rafiq. Rafiq, last week you talked about samples that were sent to Tamale and, of course, waiting for the results. Let me go to Albert because Rafiq is not ready. Albert, tell me, are the results in from the samples that were sent to Tamale last week?
Yes, I said. So what we have is 29 results out of about 260 samples that were sent to Tamale in the last 4 weeks. So according to the Regional Director of Health Services, from 4 weeks ago up to this week, 260 samples were sent to Tamale. Now, 2 days ago, they received only 29 results from those samples that were sent. And so while they were receiving that 29, another 20 had been sent again to Tamale. Now, what is happening is that out of the 29 samples whose results they've had now, only one positive. But what he says is that, unfortunately, that patient died 2 days after they took her sample. She's a 64-year-old woman who passed away just 2 days after her sample was taken. It turned out that 14 days later, they've had the results of her test, and it turns out she was positive, but she has already passed on. So the new samples, the 20 that they sent this week, include people who, had come in contact with that woman who has now died. They got those people through contact tracing, and their samples are part of the 20 that they sent this week. And been asked to self-isolate while they wait for the results.
Well, I'll get to Rafiq soon to get the reactions from the Upper West region where he is. But let me come back to you, Dr. Buckle. I don't know how you feel about the delay in test results. But again, let me ask you for the recommendations you were making, because you also have a position about the reopening of schools. I need you to tell me more about that.
You know, we are mindful that tertiary institutions are opening. These are healthy, much stronger individuals. We are talking of opening kindergartens, primary schools. And the question becomes, what is the real value of opening primary schools? What really is with the benefit of opening a primary school when there's so the risk of these children contracting it? And globally, there's a rising situation of children, pediatric COVID infections. So from a public health perspective, from protecting the population, from minimizing risk and not necessarily just opening everything up, we do not necessarily have to pursue opening up kindergartens, primary school, up to primary school, even GHS. There's no urgency in it, and there's no need to put the population at risk.
But earlier I talked about the delay in tests, and you listened to our correspondents in the Upper East region, how is this affecting our fight against the virus?
There are about 2 or 3 scenarios here. For those who are the clinicians, those who have to treat people, it makes it very difficult to confirm a diagnosis and go ahead and treat, especially when the symptoms may be like the common cold and you need to be sure what you are doing. So a delay in receiving lab results is totally not in our interest in terms of providing clinical care. The other aspect is a delay in receiving the results is also not interested in it's not in the interest of the population. These are people who may not necessarily be quarantined. They may come with one or the other odd symptom, which is not sufficient to have them quarantined. They go home, and then they come back only to find out they are positive. And you can imagine the number of people who would have been contacted them and possibly contracted the infection as well. I myself traveled and came back about 5 weeks ago. I went through the quarantine. I got my result in 6 days. But we are told now that the time for the backlog has been mopped up significantly. That's the information we have. And we're also being told that the response time is being whittled down to 2 to 3 days, which is very different from what the correspondence is saying from the field. But it is critical that the results come in as soon as possible. 24, 48 hours would be fantastic.
Dr. Gilbert Buckle is the General Secretary of the Ghana Public Health Association. I'm grateful for your time.